An ulnar collateral ligament sprain is one that you will see in throwing athletes. There is both acute and chronic mechanism of injuries for this sprain. Acutely, it can occur during hyperextension when the olecranon process is compressed into the olecranon fossa. This is the fulcrum of movement for the elbow. Additionally, when there is a valgus stress placed on the elbow, it can cause an acute sprain. Chronic conditions can also occur. Overhand throwing resulting in high valgus stress during the late cocking into acceleration phase may be one way this occurs. Also, sidearm throwers need to maintain 90 degrees of abduction at the shoulder to maintain undue stress on the UCL. So if these throwers start losing that 90 degrees of abduction, there may be stresses placed on the UCL. When looking for signs and symptoms, you will notice an intact isosceles triangle. There will be localized edema on the medial elbow over the UCL, as well as pain directly over the UCL at the medial epicondyle. The patient may also complain of pain with overhand throwing. During range of motion, you will notice a decreased flexion and extension at the elbow. The special test that you will use is a valgus stress test at 0 degrees, which will also check the integrity of the bone, as well as 30 degrees of flexion. There is also a moving valgus stress test that can be performed. In the moving valgus stress test with the patient seated, you are going to stabilize the ipsilateral humerus with the elbow maximally flexed. You're going to apply a valgus torque to the elbow and quickly extend the elbow to about 30 degrees. You're looking for pain that's generated at that elbow. Manual muscle tests should be performed to rule out flexor pronator mass, biceps, and brachialis involvement. Neurovascularly, you're going to check the ulnar nerve in the cubital tunnel. You also want to check dermatomes and myotomes. Diagnosis is generally clinical, but you may see an X-ray to rule out fracture as well as an MRI. Conservative treatment will be prophylactic with hyperextension taping or bracing. Surgical treatment consists of a Tommy John injury in cases where the ligament has completely ruptured.